With Celebrex, I will play the long version.
Ask your doctor if Celebrex is right for you.
As these pharmaceutical companies move prescription drugs into the consumer arena, as they become consumer products, they advertise them quite differently. And what they do is rely on all the same practices and conventions of conventional product advertising.
It's so good to have my enthusiasm back.
I'm enjoying things again.
And it's because of Enbrel.
They began trying to create brand identities for these products. What branding is about is trying to create an emotional bond between a consumer and a product, which is a very different kind of relationship than we've ever had to our medications before.
Any doctor can tell you about patients that come in with a list of medications that they want that clearly all came from advertisement that they see on TV. And if you watch the evening news, for example, it's all advertisement for prescription drugs.
What's the weekend hold in store for you? Ask your doctor if a free sample of prescription Cialis is right for you.
And patients come in asking for things they don't even know what it's for, right? Women who are coming in asking for Cialis or Viagra or other things, and they don't even know what they're for.
So this becomes not a rational reason for taking a medication. This is not so much about the efficacy of the drug, but about our emotional response to the kinds of social meanings they have attached to that product.
Join the millions of people with asthma who have discovered Singulair.
I just want to play. Play!
You have these ads that are sort of ephemeral kind of images unfolding before you. And to me, they seem like perfume ads or sort of something that's all about image, that's all about emotional impact.
Most of what you get in these ads are these incredibly compelling lifestyle portraits of people who are living healthy, vibrant lives thanks to pharmaceuticals. You don't really ever see the medical condition represented. You don't see people suffering from the ailment that they supposedly suffer from. You see them restored to health after they've taken the chemical.
The pleasing tones and images of these ads are often at odds with the less pleasurable list of side effects that companies by law are required to recite.
Side effects include itching, rash, diarrhea, and bruising.
Dry mouth, sweating, nausea.
Headache, flu, runny nose, and ear infection.
If you take Wellbutrin XL, there is a risk you may have a seizure.
Erections lasting longer than 4 hours, though rare, require immediate medical help.
So I think one of the things that gets misrepresented by these ads is the safety of the drugs. While you get the major statement about risks, you get an incomplete picture of the drugs. These drugs are not as safe or effective as the ads suggest they are.
According to Otis Lee Elliott's cardiologist, it's not his high cholesterol that put him in the hospital, it's the medicine he took to lower it.
Adverse drug reactions, reactions that happen even though the medication has been properly prescribed, are the 5th leading cause of death in the United States.
In fact, each year in the United States, adverse drug reactions cause an estimated 100,000 deaths and approximately 1.5 million hospitalizations. The withdrawal of the popular painkiller Vioxx from the market is a salient example of the magnitude of this problem.
Merck said today that data from a clinical trial found an increased risk for heart attack and stroke.
The arthritis drug may have caused 160,000 heart attacks and strokes.
20 million Americans took Vioxx.
Vioxx relieves arthritis pain.
Often, some say, unnecessarily, in response to advertising.
Vioxx is a superb example of what happens when you over-promote a drug, when doctors especially overprescribe a drug as a concept of promotion and give it to people who it's not indicated for, who they could have been given very cheap older drugs which would have been worked just as well. And then because the drug is only out for a few years, you then discover when it's used in lots and lots of people that it has side effects, some of them fatal, that you didn't know about.
Ask your doctor or pharmacist about Vioxx.
And in 2000, more money was spent promoting Vioxx than Anheuser-Busch spent promoting Budweiser, than Pepsi-Cola spent promoting Pepsi. I mean, that's a lot of money.
The industry group Pharma defends direct-to-consumer drug ads, saying they educate the public and get patients to doctors for treatment.
I almost feel sorry for people who try to defend the advertising as education because it's so preposterous. I mean, come on. Is it education when Nike, advertises its shoes? Like, now you know how to, cover up your feet and get from point A to point B.
That is not what a 30-second television ad of beautiful people playing in the flowers does. Also, it's self-evidently absurd to look to a company for impartial, critical education about a product it sells.
The thing is, we're not talking about whether a patient is drinking one cola versus the other. I think very few people would care if their grandmother drank Pepsi because she was being diluted by the advertising, right? Or they just had better commercials. And I think because we're talking about patients' health, that it's a very, very, very important issue.